Hi, I am Dukdui Pham from the University of Duisburg-Essen, and I have the pleasure to present to you our work regarding caries localization in smartphone images using CNNs, where we particularly investigate the feasibility of using weak supervision compared to full supervision. We are interested in this topic as we would like to find an affordable approach to early caries detection, since in developing countries such as in India, access to early oral examinations is rather limited. We'd like to leverage the increased availability of smartphone technology to do so. In particular, we'd like to use smartphone images to find possible caries areas for low-cost initial caries inspection to determine the necessity for a subsequent dental examination. Since manual annotations of the caries locations for fully supervised detection methods is rather time-consuming and expensive, we propose a weakly supervised strategy in which annotations are only given on image level. We use the faster RCNN architecture, which is often used for detection tasks on natural images, to estimate our upper baseline of a fully supervised system. It consists of a often pre-trained base network for feature extraction, a region proposal network that finds possible region candidates applying so-called anchor boxes of different size and aspect ratios, a region of interest pooling layer to make the proposed regions of the region proposal network uniform, and finally a detection network that both classifies the region of interest and regresses the location boundaries of these region of interests. For this method, annotations of the exact caries locations are required. In our proposed weakly supervised caries detection method, which is abbreviated in terms of WSCDM, we assume only image level annotations, since these are faster to generate. With these annotations, we train a standard classification network, for example, a ResNet network, which is originally not capable of object detection, but only classification. After training, we apply the so-called gradient class activation mapping concept for visualizing class activation maps based on the gradients. The generated class activation maps for the class caries highlights the areas within the input image responsible for the classification as caries, as you can see on this example. Based on these areas, we derive the bounding boxes for the detected caries locations. We additionally provided mouth region areas as location constraints to our initial approach for feasible caries locations within the class activation maps. We provided these as simple binary masks. During training, we punished activations outside these mouth regions to enforce more feasible activation areas. Our data consists of our in-house data set, which comprises 387 smartphone images of the oral cavity. 220 images of these are of patients with caries, whereas 167 images are of healthy teeth. We split the data set into training, validation, and testing, with a ratio of approximately 3:1:1. To measure our detection results, we applied several versions of the commonly used mean average precision metric on all three systems, the supervised faster RCNN and the weakly supervised caries detection method, and the extension with location constraints. As expected, the fully supervised approach yields the best results. However, we can also observe that using the additional location constraints for class activations significantly improves the detection results towards the fully supervised system. Here we have an example in which all three methods perform pretty well. we can also see that adjacent Caries locations seem to be better differentiated by means of the additional location constraints. If you compare these areas, for example, with the additional locations constraints, we get a differentiation between two areas, and without the location constraints, we don't. And in this case, we see an example in which the base classifier of our proposed method fails to recognize carriers in the input image. However, the class activation maps indicate the correct locations, and the additional location constraints even gets rid of activations outside the mouth area. All in all, we observed that both fully supervised and weakly supervised methods show promising detection results. The gap between these approaches can only be partly reduced by our local constraints, and additional local constraints seem to improve differentiation between adjacent instances. For the future, we aim to extend and improve our in-house data set. We would like to increase the number and variability of the training samples, and we'd like to differentiate between different caries severity stages that may be more challenging to detect and classify. Thank you for your attention. We are looking forward to the virtual event.